Hello, my name is Tracy Nelson, and I would like to talk to you about Senate Bill 1113. S 1113 was introduced in March 2023 by Senator Sherrod Brown from Ohio. This bill was created to bring awareness to issues with nurse-to-patient ratios within our healthcare system and how those lack of ratios ultimately affects patient care and safety. Attention was also brought to nurses' willingness to stay at the bedside due to increasing patient assignments and how the lack of proper staff also affects care and safety. This bill was read twice and then referred to the Committee on Health, Education, Labor, and Pensions, and unfortunately was not passed before the 118th Congress adjourned in January 2025. To note, a similar bill was introduced in the House by Congresswoman Jan Schakowsky. There were many campaigns and nursing strikes throughout the U.S. that led Senator Sherrod and Congresswoman Jan Schakowsky to develop and introduce bills to address the issue regarding the lack of nurse-to-patient ratios. Nurses have seen an increase in patient acuity and an increase in the number of patients they are assigned to provide care for without any regard for patient safety. This increase has led nurses to become stressed and burned out and ultimately leave the bedside for other jobs. Research has shown that there is not a nursing shortage, but rather unsafe working conditions, leading to a reduction in staff available for patient care. Research has shown with adequate nurses at the bedside, there is a lower rate of mortalities, hospital-acquired pneumonias, respiratory failure, and cardiac arrest. It has also been found that not having safe nurse-to-patient ratios results in increased medication errors, pressure ulcers, and falls due to the lack of time nurses have available to spend with patients. Economic and ethical issues to consider when requiring all hospitals to have nurse-to-patient ratios. We must look at the increased cost to the healthcare system to employ that additional staff. Bill S 1113 addresses this by adjusting Medicare payments to help hospitals cover the additional cost. It also provides stipends to the Nurse Workforce Loan Repayment and Scholarship Program and expands the Nurse Retention Grant Program to include nurse preceptorship and mentorship projects. These additional stipends and scholarship programs will allow more people to enter the nursing profession at a reduced cost. By having additional nurses enter the workforce, this will reduce the burnout many nurses currently feel and will lead to less nurses leaving the bedside. By having an optimal nurse-to-patient ratio, hospitals can see increased profits due to better care being provided and a lower number of mortalities. There is also a reduction in the length of stay, pressure ulcers, and healthcare-acquired infections, which are areas that hospitals spend increasing amounts of money. By providing better quality care to all patients, hospitals can see an increase in their financials as patients are being better monitored by nurses. As with all bills, S 1113 has its share of proponents and opponents. Those in support of the bill are nursing unions, such as the American Nurses Association and the National Nurses Union. These unions support having enforceable nurse-to-patient ratios and see it as an essential way to achieve appropriate staffing levels. Those opposed to Bill S 1113 include nursing homes and long-term care facilities. These facilities feel that they already have trouble retaining nurses, and by having required nurse-to-patient ratios, it would create a bigger staffing issue for their facilities. Hospitals are also opposed to the bill, saying that it can become costly, and they have concerns who would be responsible for that increased cost. Some hospital administrators have argued that the ratios are not realistic for all facilities, and staffing ratios should be based on the size of the facility, along with the acuity of the patient served, rather than a required staffing number. Bill S 1113 is essential for all areas of healthcare, including the patients but also the nursing providers. The goal is to provide the best care possible for the patient while also protecting the nurse's well-being and mental health. S 1113 not only includes plans for setting up adequate staffing plans to set a minimum number of nurses to patients, but it also addresses payment of the additional cost to increase the number of nurses available. As I reviewed this bill, I thought it would be beneficial to have additional reviews on how the increased cost could be handled, whether it's by increasing Medicare payments, or would there be an increase in taxes to cover the cost? And if so, how will that be addressed by each state? I also thought it would be beneficial to consider whether a one-size-fits-all approach is appropriate, or should the bill address facilities by size and/or acuity?